Hello students, here we are with another lecture on bioassay. Today we will talk about bioassay of ACTH and D-tubacurarine. In our earlier lectures, lecture 42, we had talked about the bioassay of its principles and various methods. Then we also talked about in our next lecture about bioassay of insulin, oxytocin and vasopressin. And today we will talk about bioassay of ACTH and D-tubacurarine. I am Monica Sachdeva, professor at Rajkumar Goyal Institute of Technology. This presentation will carry you through what is ACTH, what is the hormone which is regulated by ACTH, and how bioassay of ACTH is carried out. Then we will also talk about what is D-tubacurarine, what is its role and how a bioassay of D-tubacurarine is carried out. So, let us start. Now, before going into the bioassay of ACTH, let us first talk about what is this ACTH. ACTH is adrenocorticotropic hormone, or we also call this as corticotropin. This is a polypeptide tropic hormone which consists of 39 amino acids, and it is secreted by anterior lobe of pituitary gland. ACTH, it stimulates the adrenal glands to produce and release a corticosteroid hormone from the adrenal cortex. This corticosteroid hormone, or we call it as a cortisol, this is important for regulating the glucose metabolism, protein metabolism and lipid metabolism. It also suppresses the immune system responses and also helps in maintaining blood pressure. Now, how is this cortisol synthesis regulated? You can see here in the diagram, when there is decrease in the cortisol level, this hypothalamus, it stimulates this corticotropin releasing hormone. This corticotropin releasing hormone, it stimulates the pituitary gland, and this pituitary gland, it then stimulates this, releases ACTH. ACTH then stimulates the adrenal gland, and adrenal gland, it acts on this adrenal cortex to release the cortisol. So, that is how this cortisol synthesis or release is regulated by ACTH. Now, we will talk about bioassay of ACTH, that is adrenocorticotropic hormone. Now, as we talked about earlier also, whenever we are carrying out bioassay of a drug, we need to have a standard sample and we also need to have a test sample. So, similarly here we have some official preparations of ACTH. These are corticotropin injection, which is a sterile solution which is in a suitable diluent. It is of a polypeptide which is derived from the pituitary gland of a mammal, and the potency range is around 80 to 120% of USP corticotropin unit. Then another official preparation is corticotropin for injection. Another official preparation is repository corticotropin injection, and this is generally used as a reference standard for the bioassay. Now, what is this? This is a corticotropin in a sterile solution of partially hydrolyzed gelatin, which is intended for subcutaneous use as well as for intramuscular use. So, this repository corticotropin is generally used as a reference standard whenever we perform bioassay of ACTH. Now, what is the purpose and what is the principle rather behind performing this ACTH? Now, when we administer ACTH, it decreases the ascorbic acid which is present in the adrenal glands. and this depletion of adrenal ascorbic acid, this is a function of the dose which we administer of ACTH. And this relationship, that is decrease in the ascorbic acid in the adrenals, this relationship, this has been used as a quantitative assay of ACTH. So, the principle is when we administer ACTH, it decreases the ascorbic acid content which is present in the adrenal gland, and this decrease in the ascorbic acid content in the adrenal by the standard and the sample, that is compared, and that is how the potency of a test sample is calculated in comparison to the standard ACTH sample. Now, to carry out bioassay of ACTH, we need to prepare certain solutions. This solution, this consists of the 5 units of test sample or the standard sample. It is dissolved in 0.25 ml of 0.5% phenol solution, and it is diluted with 8.1 ml of 15% gelatin solution. This solution A, it now contains 300 millunits of ACTH per 0.5 ml. Then this solution A is further diluted, further dilutions are made. From this 3 ml of solution A, it is diluted with 6 ml of gelatin solution, and now this concentration is now reduced to 100 millunits of ACTH per 0.5 ml, which is solution B. Then we have solution C. Again the dilution of sample B is carried out. The 3 ml from solution B, that is diluted with 6 ml of gelatin solution, and this results in a solution which now consists of 33 mu ACTH per 0.5 ml. So, we have 3 standard solution now, S1, S2, S3, which have 300, 133 or units of ACTH per 0.5 ml, and similarly 3 test samples, same samples. Now, how do we perform this bioassay? We take here male Wistar rats are taken. The weight is around 100 to 200 grams. The pituitary gland is removed surgically 1 day prior to the test. Then 3 doses of the test, 3 doses of the standard, they are administered to the rats, which are divided into 6 groups, 3 for the test and 3 for the standard preparation. And the number of animals required is either 36, so the N will be 6 and or it could be 60. Each group will contain 10 animals. So 36 to 60 animals we require, and for all animals a day prior to carrying out the bioassay, their pituitary gland should be removed by surgery. Then each rat, it receives subcutaneously 0.5 ml of different concentrations we had prepared, S1, S2, S3 and T1, T2, T3 of the test or of the standard. Then 3 hours after injections, the animals, they are anesthetized, adrenal glands are removed, any tissue which is attached to those adrenal glands, that is removed, the tissue is weighed, they are homogenized, and again they are homogenized, and the content of ascorbic acid is then carried out by the standard procedure, and the potency of this is then carried out. Now, here important point is that how do we determine the ascorbic acid determination? We require various reagents to carry out the estimation of ascorbic acid. We require ascorbic acid solution 0.02% ascorbic acid solution, 85% sulfuric acid, then 0.02 gram per ml of dinitrophenolhydrazine in 9 normal H2SO4, Then we also require 0.06 gram per ml of thiourea, which is dissolved in distilled water, charcoal preparation of ascorbic acid solution, then solution A, which is 1% solution of ascorbic acid, which is dissolved in 4% TCA, that is trichloroacetic acid. Then solution B, which consists of 0.2% of ascorbic acid solution, and solution C, which consists of 0.02% ascorbic acid. These are the solutions, the reagents which are prepared to carry out the determination of ascorbic acid. Then certain other reagents, they are also prepared, and to carry out the determination of ascorbic acid, trichloroacetic acid 4%, it is added into various solution C, solution B of ascorbic acid, which we had prepared. A calibration curve is established, various dilutions are carried out, and the calibration curve is then established at a wavelength of 540 nanometer, and using the solution without ascorbic acid, that is taken as a blank solution. Now, we summarize the bioassay of ACTH, how we carried it out. We take albino rats, 36 to 60 in number. Each rat pituitary gland is removed by surgery. All these animals, they are divided into 6 groups, each group containing 6 to 10 animals. These 6 groups, 3 groups for standard. These 3 groups are for the standard S1, S2, S3, 33, 100, 300 milliunits. Then we have 3 groups for the test, T1, T2 and T3, and the amount which is injected is 0.5 ml by subcutaneously it is injected. Then 3 hours after injection, animals, they are anesthetized, adrenals are removed for ascorbic acid determination. These adrenals, they are homogenized in the glass tubes, which contains trichloroacetic acid 4%, and ascorbic acid is determined by spectrophotometric method at 540 nanometers. And then the mean of standard and the test, it is then calculated, and the potency of your test sample in comparison to standard sample, it is then found out. This is how the bioassay of your ACTH, that is adrenocorticotropic hormone, is carried out. Now we talk about bioassay of D-tubocurarin. Now what is this D-tubocurarin? This tubocurarin, it is a naturally occurring alkaloid which is obtained from the bark of a South American plant which is called as Chondrodendron tomentosum. Okay, so it is a South American plant, it is an alkaloid, a naturally occurring alkaloid. We all know that this tubocurarin word कहाँ से आया? That comes from the word curare. पहले जब अर्ली पीपल जो थे वो हंट करते थे एनिमल्स को, सो दे यूज टू यूज दिस क्यूरेरे फ्रॉम दिस, तब नहीं पता था ये डी ट्यूबैक्यूरारिन है, बट दे कॉल इट एज क्यूरेरे एंड इट वाज कॉल्ड एज अ एरो पॉइजन. तो एनिमल्स को किल करने के लिए, हंट करने के लिए, स्पेशली जो साउथ अमेरिकन नेटिव्स थे, दे यूज दिस प्लांट टू किल द एनिमल्स, टू हंट द एनिमल्स. And how they were able to eat the animals who were contaminated with this curare? There were no adverse effects. How they were able to eat? Because tubocurarin, it cannot cross the mucous membrane. For D-tubocurarin to produce its action, it has to be given parenterally. It is not effective orally. So that is how the people, they used to hunt the animals with this curare or this arrow poison, which we call as D-tubocurarin, and there were no adverse effect when they used to eat the flesh of the animals infected with this curare. Now this D-tubacurarine, it is a non-depolarizing skeletal muscle relaxant. It is a competitive and reversible antagonist of nicotinic acetylcholine receptors, and we call them as NM receptors. This blocks NM receptors at neuromuscular junction and it causes relaxation of the skeletal muscle. But if we use this in overdose, it can lead to muscular paralysis, and this effect is observed when we are performing bioassay of D-tubacurarine. So this effect that it causes the relaxation of the skeletal muscle, this is the principle which we use when we perform bioassay of D-tubacurarine. Now, to perform bioassay of D-tubacurarine, we use two methods. One is the rabbit head drop method, and another is when we use the rectus abdominis muscle of the frog. So first we talk about the rabbit head drop method. Now, what is the principle behind the this bioassay of D-tubacurarine? This D-tubacurarine hydrochloride that is injected into the marginal vein of rabbit ear till the rabbit's neck muscles are relaxed, so that animal cannot hold it up. You can see it here in the diagram. We are administering this D-tubacurarine into the ear, and you can see it here that the head of the animal, it drops. It is not able to uplift that its head. So this is called as the head drop method, because the skeletal muscles are now relaxed. So the total amount of the test sample which is required to produce this endpoint, it is compared with the total amount of the standard sample which is required to produce the similar endpoint. So this is a quantal type of bioassay where we are using the whole animal and we are seeing the endpoint. The animal is not able to hold its head. So how do we go about it? We select the rabbits which weigh around 2 kg of weight. The animals, they should be free from any disease. They should be obtained from a healthy colony, and when we bring them into our own animal house, they should be acclimatized to the conditions of the animal house. Now see here, as we talked about the marginal vein, this is the marginal vein, this is the ear. You can see it here that it is so thin that all the veins are cleared. So we administer the drugs into this marginal vein, and whenever we withdraw the blood also, we do it from this marginal vein only. Now what is the experimental procedure? We place the animals in a holder with its head protruding outside, as we saw in the last diagram. The head should be freely movable. 8 rabbits, minimum of 8 rabbits are used, divided into 2 groups. Each group contains 4 animals. One group will receive standard sample and the second, it receives the test sample. Then D-tubacurarine is injected at a constant speed by infusion. It is not given in a one shot injection, given by infusion, and the infusion is continued till the rabbit is not in a position to hold its head erect, or there is no response when we focus the light on the eye, that is, there is loss of the light reflex. Why this happens? Because the skeletal muscles, because the muscles, they are relaxed. So this is the principle. We keep on injecting the drug till the head drops, और कितना amount test ने use किया, कितना amount standard ने use किया, we compare both of these and then we find out the potency of your test sample in comparison to your standard. Okay. Now generally some of the rabbits, they can recover, but if because muscles relax हो रहे हैं, so sometimes respiratory distress could also occur. So in that case, neostigmine could be injected to the marginal ear vein. Now, to minimize the biological error, we can use a crossover design also. We earlier also talked about crossover is when the next day जिन एनिमल्स को हमने स्टैंडर्ड दिया था, नाउ वी एडमिनिस्टर टेस्ट टू देम, और जिन एनिमल्स को हमने टेस्ट डोज दिया था, वी नाउ एडमिनिस्टर स्टैंडर्ड डोज. वी कंपेयर द हेड ड्रॉप, द अमाउंट ऑफ द ड्रग विच इज रिक्वायर्ड for the head drop, and finally we find out the concentration of the test by using the formula threshold dose of the test which is required for the head drop divided by threshold dose of the standard which we have used to we have used in our experiment, in our bioassay, which causes the head drop, multiplied by concentration of the standard D-tubercularian sample. So that is how we carry out the bioassay of D-tubercularian by rabbit head drop method. The principle remains the same, that is the D-tubercularian, it causes skeletal muscle relaxation, and when we administer the drug to the standard and to the sample, the rabbits, they are not able to hold their head erect, they drop their head because of skeletal muscle relaxation, and that is how we can find out the potency of the test sample in comparison to the standard sample. Then we can also carry out bioassay of D-tubercularian by using frog rectus abdominis muscle. This is the frog, this part हम एक्सपोज कर लेते हैं, ऊपर का स्किन कट करते हैं, पिथ करते हैं, एंड दिस पार्ट, ये आप ये जो देख रहे हो, दिस इज द रेक्टस एब्डोमिनस मसल. सो यहाँ से वी कैन गेट 2 रेक्टस एब्डोमिनस मसल. सो द प्रिंसिपल involved in this bioassay of D-tubercularian when we are using frog rectus abdominis muscle is that this potent skeletal muscle relaxant, it inhibits the contractile response of acetylcholine. So the inhibitory effect of test sample of D-tubercularian against the standard acetylcholine, it is then compared with the standard D-tubercularian. So the procedure, the frog is picked, laid on the back, उसको बोर्ड पे पिन कर दिया जाता है, स्किन जो एब्डोमेन का स्किन है इट इज रिमूव्ड, रेक्टस एब्डोमिनस को डाइसेक्ट कर लेते हैं, मसल को जो है इट इज पिन एंड देन इट इज पुट इन द ऑर्गन बाथ. ऑर्गन बाथ इट कंटेन्स द फ्रॉग्स रिंगर सॉल्यूशन, एंड दिस रिंगर सॉल्यूशन इट कंटेन्स sodium chloride, potassium chloride, calcium chloride, sodium hydrogen carbonate, glucose and distilled water made up to 2000 ml. So this is the frog ringer solution, or we call as the physiological salt solution, to maintain all the conditions externally, and this is the in vitro experiment, the graded response bioassay method which we are using here. The oxygenation is carried out, then muscle is stabilized for around 30 to 45 minutes. Frontal writing lever is used, 1 gram of load is used when we are using bioassay of D-tubercularian, and again as we had seen in the bioassay, the types of graded bioassay, it is by matching, it is by interpolation, or it is by multiple point bioassay. We can select any of the method for carrying out this bioassay of D-tubercularian by using frog rectus abdominis muscle. And from that, the potency of the test sample as in comparison to the standard sample, to the standard curve, it could be used out. You can see here in the diagram, what I have shown here is that this is your frog rectus abdominis muscle. You cut it into 2. So one frog में से आप 2 आपके samples मिल जाते हैं. then you put it into this organ bath. ये आपका liver है, it will record the responses. जब आप इसमें drug डालेंगे, it will produce the contractions. This is how the contractions will be produced. So in response to the sample or in response to the standard D-tubacurarine, how much responses are produced by your test sample, you can record it, and this is a graded point bioassay. You can carry it out by bracketing, by matching, or by interpolation, or by any of 3-point, 4-point, 6-point, 8-point bioassay. So that is all about this bioassays of. Thank you very much.